Rescue breaths are artificial breaths given to someone who is not breathing. They are given by blowing air into the mouth to inflate the lungs. The air you breathe contains about 21% oxygen. Your exhaled air still contains between 16% and 17% oxygen. This exhaled oxygen is enough to support someone's life. To give rescue breaths, you need to make sure there is an open airway. The airway is the only path for getting air into the lungs. An unresponsive person can lose muscle tone. If flat on his or her back, the base of the tongue can relax and obstruct the airway. This is the most common cause of a blocked airway. The tongue is attached to the lower jaw. Lifting the jaw forward pulls the tongue away from the back of the throat and opens the airway. You can open a person's airway by using the head tilt chin lift technique. Place one hand on the forehead. Place the fingertips of your other hand under the bony part of the chin. Apply firm backward pressure on the forehead while lifting the chin upward. This will tilt the head back and move the jaw forward. Maintain the head tilt with your hand on the forehead. Leave the mouth slightly open. Avoid pressing into the soft tissue of the chin with your fingers, as this can also obstruct the airway. Even though the risk is very low, as a BLS provider, use a protective barrier such as a CPR mask when giving rescue breaths to minimize your exposure to infectious disease. Before using a CPR mask, quickly inspect it to make sure the one-way valve is in place. Place the mask flat on the person's face with the top of it over the bridge of the nose. Use your thumb and forefinger to provide uniform pressure around the top of the mask. Use the thumb of your hand lifting the chin to control the bottom. Tilt the head and lift the chin to open the airway. Lift the face up into the mask to create an airtight seal. Blow through the valve opening to deliver breaths. Each breath should be about 1 second in length and have only enough air to create a visible rise of the chest, but no more. Additional air is unnecessary. Remove your mouth and let the person exhale completely after each breath. Take a fresh breath between delivering breaths. If you remove your hands from the head, the airway will close again. It is necessary to open the airway each time you give rescue breaths. Rescue breaths for children and infants are performed in the same manner as for adults. It is recommended to use an appropriately sized pediatric CPR mask. The airway of an infant may become blocked if the head is tilted too far. Position an infant's head in a neutral position, in which the ear openings are level with the infant's shoulders. Special care should be taken not to give too much air in a single breath. Provide only enough air to make the chest visibly rise, but no more. The jaw thrust is a convenient airway technique, especially when working in a team or when using a bag mask device. Position yourself above the head of the person. Place the mask flat on the person's face with the top of it over the bridge of the nose. Place your thumbs and heels of your hands along the sides of the mask to seal the mask against the face. Hook your index fingers under the angles of the jaw just below the ears. Lift and tilt the head backwards. Use counter pressure against the cheeks and displace the jaw and move it upward and into the mask. This will open the airway. Blow through the valve opening to deliver breaths. Each breath should be about 1 second in length and have only enough air to create a visible rise of the chest, but no more. A bag mask device allows rescuers to provide rescue breaths without having to blow into a person's mouth. It can also deliver high concentrations of oxygen when connected to an oxygen delivery system. A bag mask can be used by a single BLS provider, but is best used by two. From above the head, place the mask flat on the person's face with the top over the bridge of the nose and use the jaw thrust airway technique to establish an open airway. Have a second BLS provider squeeze the bag with both hands to ventilate. Squeeze the bag slowly enough to deliver each breath over 1 second. Make the chest visibly rise, but no more. When using a bag mask as a single provider, position yourself above the person's head. Place the mask flat on the person's face with the top over the bridge of the nose. Use the thumb and index finger of one hand around the valve in a C position to seal the mask against the face. Use your remaining 3 fingers in an E position under the bony part of the chin. Tilt the head back and lift the jaw up and into the mask to open the airway. Use your free hand to squeeze the bag and deliver the rescue breaths. Deliver each breath over 1 second. Make the chest visibly rise, but no more. Bag mask rescue breaths for children or infants are done in the same manner as an adult. It is recommended that an appropriately sized pediatric bag mask be used. When caring for someone who is seriously injured, establishing an open airway is a higher priority than protecting a possible injury to the spine. Without a patent airway, a person will not survive regardless of injury. When the potential for a neck injury exists, a jaw thrust without head tilt can be used to open the airway. Position yourself above the head of the person. Place the mask flat on the person's face with the top of it over the bridge of the nose. Place your thumbs and heels of your hands along the sides of the mask to seal the mask against the face. Hook your index fingers under the angles of the jaw just below the ears. Use counter pressure against the cheeks to displace the jaw and move it upward and into the mask without tilting the head. If you find the jaw thrust without head tilt does not open the airway, use jaw thrust with head tilt or the head tilt chin lift technique instead, even if neck injury is suspected. You must establish an airway for a person to survive.